Developments concerning the troubled Obamacare rollout to tell you about.
Fox News has learned the White House feared the website would not work. Internal emails reveal senior technical advisors warned the administration days before launch that the site could crash. And though it is still having problems, the New York Times reports a glimmer of hope. Navigators say they have seen major improvements in the online application process. The Washington Post, though, points out that millions of Americans looking for coverage under Obamacare will not have access to some of our nation's best hospitals. They're being excluded from many of the plans to keep costs low. In the meantime, House Republicans are hearing the concerns of their constituents. We are awaiting a Google Hangout set to get underway a little bit later in the hour. Let's talk about it all with Nina Easton, the senior editor and Washington columnist for Fortune magazine and a Fox News contributor. So now we know there were warnings from guys like Henry Chow, the guy who was kind of tasked with getting this website assembled. He was telling the White House days before launch that this thing could crash, and we have to find a way to make it palatable. I mean, to make the problems palatable. Why did the White House insist on rolling it out on October 1st?
Well, I think we have to be cautious sometimes in taking these emails. You don't know what kind of context they were in. Nevertheless, you're right. There was concern that if it crashed, that the press would make a big deal about it. And I think this follows on, by the way, John, a McKinsey report last March, which showed that there were concerns about the design was still evolving, requirements were still evolving. It showed a kind of fly-by-night, seat of your pants kind of operation. So why did they go forward with it? Political. I mean, they were determined not to give in to Republicans, not to give in to calls for a delay, and to go no matter what.
Here's the phrase from Henry Chow that he wrote to the development team. Can you think about a better way to convey to the public when the site is not available? I am picturing in my mind all the major print and online publications taking screenshots of what is below and just ramping up the hyperbole about hc.gov not being functional. It does seem like they had plenty of concerns, but they rolled it out anyway. Now, President Obama is essentially blaming Republicans for the rocky start of Obamacare. What do you make of that?
Of course, he's blaming Republicans, and then he's also going to be blaming the insurance industry because he went back and said you can actually now that you can keep your insurance policy, all those policies that were canceled. Insurance industries is saying we can't really do that necessarily. So he can blame the insurance industry as well. He can blame state commissioners. He can blame everybody but himself. He did his big mea culpa last week, but really, at the end of the day, it's not clear where the buck stops. And what comes across, particularly in that McKinsey report, John, last March, was that there's no clear person in charge calling the shots, no clear line of responsibility. That's just not something you would see in the private sector.
But you think back to the days and hours that led up to the government shutdown. Republicans were saying, hey, we'll fund the government. We just want to delete money for Obamacare. Or how about we delay it for a year? And that did not pass muster.
Well, what's interesting is actually it would have been in the White House's interest to delay. Even after it came, let's say it came out, it had all those problems. If he had shut it down and did a reboot and a restart several months later, they'd probably be in better shape than they're in now. Because what we're hearing now, we're having all these emails come out. We're having people still having trouble signing up on these on the website. And as you alluded to in the beginning here, we're finding out that people can't necessarily get the best care. Sick patients can't get into the best hospitals under Obamacare. That's a life and death issue.
I was just about to bring that up with you. The Washington Post, big story today about how, for instance, Seattle Children's Hospital, an appendectomy there costs more than it does at a community hospital. So the big healthcare insurer up there has decided to exclude Seattle Children's, and people are fuming. Now, healthcare is not, it's not a hardware store. A bolt is a bolt maybe from one store to another, but not necessarily a doctor in an operating room.
And that's the problem with this one size fits all. And this is, again, this is a life and death question. Yes, they're trying to contain costs. So they're just including hospitals and systems where the price is right. I understand that. But in cases like the Seattle Children's Hospital, the price is higher because they're treating sick children who have an underlying issue already. A child who might have tonsillitis but also has cancer. There's a reason behind that. So that's when you get in this problem of this one size fits all. And then we, of course, have the stories of people losing their insurance altogether who are fighting cancer or stage 4 cancer victims. I mean, these are real people and real illnesses.
Well, and the White House is defending the program so far. They were out yesterday with some information saying that they've been able to push down the costs of health care. But if this is how they're doing it, that's not going to satisfy many people.
This is a disaster. This is, political disaster for the president, because not only are people losing insurance, sick people are not getting the kind of quality care. And it all goes back to this promise that he made to us. Don't worry, it's not going to affect you. It's not going to affect your quality of care. You're not going to lose your insurance. It goes back to just a fundamental commitment that he made to the American people.
Yeah, that soundbite has certainly been played, and Republicans are saying it is going to be a huge issue in the elections coming up less than a year from now. Nina Easton from Fortune magazine. Nina, thank you.
Thank you, John.